All right, welcome everybody. I'm excited to have you all here for our December meeting, our last meeting of the year, and I'm excited to see some of my leadership team, Megan and Gabby, joining the meeting today. We will start off with some just quick announcements and a couple of calls, and then we'll get right to our webinar with Dr. Fraser today. All right. So the first thing I want to say is if you're new and you want to get more involved in the PCBH SIG, feel free to go to our website and click on our button to join, or you can go ahead and email our current secretary, Samantha Kettle, who will get you connected to our special interest group. Other things we want to highlight is, we're always promoting jobs in the integrated primary care field. So you can go and find job postings at integratedcarenews.com. But we also invite you to go ahead and put those jobs in our chat right now. We want to create a community. And so love to have you put that in our chat right now. If you want to send messages to PCBH SIG members as well as CFHA in general, you can always email the listserv at cfha@gaggle.email, and that will go to all PCBH members as well as CFHA members to have responses. And we also want to highlight that about 1 to 2 weeks before each webinar, and we have about 5 to 6 webinars a year, you should see our newsletter advertising our webinars coming up, any special events, research corners, or interesting information to take a look at. I just want to highlight our current leadership. You can, as I said before, Gabby and Megan are on here, but we have Samantha, who's our secretary, Rosemary, who's our early career professional, and Sierra, who's our student representative, who couldn't join us today. And we are looking for new leadership opportunities for the 2024. So our due date is coming up soon. We extended it to this Friday. So if you have an interest, please feel free to reach out to us about each position. We're recruiting for almost every position: co-chair, member at large, secretary, early career representative, and student representative. Gabby sent out an email earlier this week just giving quick quotes about a little bit more about each position and the time commitment. Time commitments tend to be less than 3 hours a month, including meetings, and tend to ramp up a little bit towards our CFHA conference. This is just a quick snapshot of what we've done over the last year. We've had presentations on gender care, family-centered perspectives in PCBH. We hosted a Meet the Mentor session at our conference that was highly attended and given good reviews on. And today we'll be hearing from Dr. Fraser on mentoring underrepresented professionals in collaborative healthcare settings. So we're also always looking for mentors and mentees. If you're someone interested in receiving mentorship, please send an email to Rosemary at rosemaryhalesid@gmail.com. And if you're interested in becoming a mentor, which we're hoping we'll get more mentors after this webinar as well, you can go to our website and fill out our mentor application so we can grab a couple of quick information in order to match you successfully with a hopeful mentee. And without further ado, I'm going to hand it over and stop sharing my screen to Dr. Catherine Fraser, who's going to speak with us again about mentoring underrepresented professionals in collaborative healthcare settings.
Thank you, Brittany, and I will go ahead and share my screen. So welcome, everyone. My name is Catherine Fraser, and I am in the Halifax Health Family Medicine Residency in Daytona Beach. And before I get started, it would be really helpful to me to know my audience. So if you would like to just take a moment, put yourself in the chat. Just let me know where you're located and what you do there. That would help me to have an idea of our audience. I am relatively new to CFHA. I did attend and present at a conference a few years ago. However, I'm not a member of CFHA, so I'm not very familiar with the membership. So it would really help me if everybody could just put some information in the chat just to give me an idea of our audience. And let me say, I intend for this to be very interactive, and feel free as I ask questions, feel free to respond in the chat. I'm also really okay with people just unmuting themselves and speaking out. I really much prefer to be interactive as opposed to just doing straight lecture. So our objectives for today, and I had a quick chat with Gabby and Brittany for them to sort of give me an overview of what they were looking for. And I'll be basing this on some of my experiences with previous mentorship projects that I have done. So the objectives we came up with are to really help identify skills and challenges of URM professionals, underrepresented minority professionals in collaborative settings. And I really want to include looking at skills in addition to challenges, and really encourage folks to think of mentorship from a skills-based place. Describe areas of growth for mentors working with URM mentees. And I'm going to be getting into, I think, some of the personal experiences that you can go through as a mentor to really develop your mentorship skills, and then also try and give some practical tips. And then I am also going to talk about strategies to develop mentorship that is culturally appropriate and culturally responsive. And that includes the mentor understanding their own background as well as their mentee's background and some of the things they might go through as a professional who's underrepresented in healthcare. And thanks for everybody who's talking in the chat. It's great to see the diversity of members here. So a little bit about myself. I'm currently a faculty member at Halifax Health Family Medicine Residency, located in Daytona Beach, Florida. I am the psychologist on the faculty. I'm also a psychotherapist. So in addition to teaching, I do have a psychotherapy practice. I teach all topics involved in primary care, behavioral health care, and specifically have developed curricula in health equity, anti-racism, and various DEIA topics. And as far as my experience with mentorship programs, I have been very fortunate to be involved with and have leadership positions in 2 mentorship programs through the Society of Teachers of Family Medicine, where I'm pretty active. And the first one was the Behavioral Science Fellowship for Early Career Behavioral Science Professionals, and that's a picture of the 3rd class that I was involved with. And I'm also currently involved in the Underrepresented in Medicine mentorship project. And that's how I had the pleasure to get to know Brittany and Gabby, who were both mentees in that project, and taught me, I believe, much more than I could teach any of them. So mentorship is wonderful. You learn so much as a mentor. So I want to start out by really, kind of getting us to this place of why do underrepresented BIPOC folks of color, what are their unique needs as far as mentorship? And, through my experiences with behavioral science, but also with the Underrepresented in Medicine project, we just know that many BIPOC mental health professionals in the integrated behavioral health spaces can really experience a sense of isolation, and like they can't relate to others. It's not unlike in my profession as a residency faculty in family medicine, where I'm, there are usually a lot of times just one behavioral health person, or maybe a small number, 2 or 3. And then for those of us who are minorities, we're truly really the only. So that sense of isolation is something to really think about when you're trying to focus on needs of a mentee. So what I want to do to help us understand this even a little bit more, we're going to do a breakout session in just a few minutes. But before that, I want to share this really lovely quote from Patricia Churchland that says, "Belonging and caring anchors our sense of place in the universe." And, for those of us who are fortunate to have really enjoy their job and be in a really nice setting, I think this resonates with you because it's taken years, but of course I feel very grounded and a sense of belonging where I work. And but it wasn't always that way. And I know that I've had my shares of times when I felt very isolated and like I just didn't know what I was doing. And however, I had mentors out there who gave me concrete advice and support and helped me to feel a sense of belonging. So we're going to break up into groups of 3. And what I want you to do in this breakout group is to think of a time when a mentorship experience helped give you a sense of belonging. I think we can all think of times where we started somewhere, we were just starting, or we moved somewhere, we were brand new, and we found folks to give us that sense of mentorship and support. And so I want to start out, if we can go to breakout groups of 3. And since I have a fairly long presentation, we'll just take a short period of time. So maybe about 5 or 6 minutes, let's say 6 minutes in the breakout groups, and just share that with the other people in your group. And when we come back, we'll talk about what your group discussed. So.
Okay, I think we're all back.
Okay, great. So I would like to hear from those of you who were in the breakout room. So you had the opportunity to talk about when a mentor did something meaningful to you to help give you a sense of belonging. And I'd like to hear, you can talk about your experience, or if there were themes that came up in your group. What were the things that your mentors did to help give you a sense of belonging? And again, I invite you to put the information in the chat if you'd like to, or certainly unmute yourself and just go ahead and tell us.
I know one thing my mentor did for me when I was transitioning into a new job is just help me with like communication and language, which made me feel a part of the team and made me feel less anxious and like sticking out. So that was super helpful for me.
Yeah, great. And I think that's a perfect example of something that we don't necessarily think that our early career professionals would want or need help with that, but something just so kind of basic and simple. You want to fit in, you want to put your best foot forward, and communication and language is certainly a great example of practical ways to help your mentee.
The chat from Megan, providing support in times of uncertainty in career or job. That was a theme in our conversation.
Absolutely. And it can be support in a big form and fashion, such as, supporting you in a meeting, or it can be just behind the scenes, having your door open so that someone can drop in.
We have another response in the chat from Robert. I shared how, as a grad student, a practicum supervisor created social spaces for all of us outside of clinic care to help us create community.
Another really good example, and I know in the 2 mentorship programs that I mentioned that I've been a part of, that's actually a big part of the feedback that we get, that it's helpful when it goes beyond the professional, and certainly when there's opportunities to meet or to have the mentor help you get connected in a social sense, that also is very helpful. Okay, well, thanks for sharing those. So as we move into talking about what our mentees might need from us. Oh, and I see that there is another comment in the chat from MM. Had amazing mentors who served as a conduit, championed me to the rest of the medical research teams. Absolutely. Modeled advocating for the profession of psychology, fantastic, and the underserved populations. Then connected you with the networks and individuals that could help you. Certainly when somebody is, can just be so concrete in the helping you go through those steps that it would have been harder for you to go through those steps on your own. So to have a mentor jump in there and really help you get connected can be extremely meaningful. So as we move on to thinking a little bit more about what the mentees experience is, what mentees experience. And so, and you all can help me out with this because you're in the primary care integrated health settings. What are some of the challenges you think of early career URIM mentees? Just taking a guess or sharing from personal experience.
I would say some of my trainees often come in and they're worried about just the hierarchy in general of medicine, and then particularly URM individuals. There's not many people who look like them as well, and so that is another risk of speaking out. So another layer to that hierarchy.
Yeah, certainly for any early career professional, wanting to know where they fit in, basically what their place is. They want to put their best foot forward, and yet they want to respect the hierarchy and the authority. And then being a person of color, a person of a different or unique background, in some ways not wanting to stand out more, and in other ways really wanting to stand out and look like you know what you're doing. So, it's two sides to the same coin, but definitely present challenges. And so, kind of what we're talking about being the only, that sense of isolation, fears about discrimination or being marginalized, being pigeonholed, and really seen as, looking at them through the lens of how they've looked at other people who look like them, and bringing those biases in. Not having folks to turn to who you feel like naturally could be role models to you, that have a similar background to you, that have a similar experience to you. We, in the URM mentorship program, we talk a lot about the difference between BIPOC individuals and majority individuals in terms of a professional legacy. And many have been the first to go to college or the first to become a professional, something like that. Whereas our majority counterparts may have had that legacy of several generations of people having gone to school or become professionals. And then, of course, the whole notion of microaggressions. And, microaggressions, and I'll go into more detail in this later on in the talk, but microaggressions often are not meant to be overt acts that show discrimination or pigeonholing or stereotyping, but just kind of offhand comments that make somebody stand out. Like if somebody is surprised that, oh, you have your doctorate or something like that, and maybe they don't mean it in a bad way, but it's sort of like, okay, so you look at me and I look like somebody who shouldn't have a doctorate. So that's just an example. We talk a little bit more about microaggressions a little bit later. And then, so when I think about the skills of early career mentees, and as I mentioned in the beginning, really want to come into this mentorship from a skills-based perspective, and really being able to draw on the positives and what people can potentially bring to the situation, and to really assume that they have a lot to offer, as opposed to that they are any less capable than others. And so, I think in addition to coming in with a fresh perspective, when you think of some of the things that URM professionals may have experienced in other aspects of their life with discrimination and being stereotyped, and just being able to bounce back from that and having that inner sense of resiliency, that sense of persistence. Again, if we think about it in terms of professional legacies versus, being the first or the only, you really have to keep going. And a lot of times you're stumbling through and finding things out, just by stumbling through, that there isn't somebody who's necessarily helping you to brave a path. And then to have to come up with sometimes unique and creative solutions to problems, and having to, perhaps get through your graduate program as the only person of color, and all the things that you had to do to really bring yourself up and motivate yourself and help yourself keep going. So just to focus in a little bit more on microaggressions. So you can see some of the folks in this little graphic, some of the phrases. So I would never have guessed someone so young could do so well on that project. So maybe the person saying it thinks they're complimenting them, but maybe the person receiving it doesn't feel that way. Where was your family from before they came here? To have people inquiring about your background because you look like a person of color. In America, we tend to really kind of separate each other by cultural ethnic background. And sometimes that can feel like, okay, why is this person scrutinizing me? Your English is great for someone who isn't from this country. Again, maybe meant as a compliment, but did you think maybe that I don't speak as well as others, or I don't have such a good vocabulary? You are so articulate. And again, are you implying that I look like someone who wouldn't be so articulate? And that question, oh, you're the boss? Again, do I possibly look like somebody who wouldn't necessarily have a leadership position? So, I think it's important to bear in mind that microaggressions exist and they happen. And like I said, most times they are not meant to be something negative. However, a kind of a little golden rule to think about: if your mentee comes to you and says, I really feel like, these comments are just really kind of like a subtle put down, rather than saying, oh, you shouldn't feel that way. How about saying, gosh, that sounds painful. Tell me more about that. And maybe, gosh, I personally haven't experienced that. Can you tell me more about that? So really take it seriously and take it under consideration if your mentee talks about microaggressions. So some of the stressors that might be experienced by URM professionals in an integrated care setting. So a little vignette. Nora loves her new job in Integrated Health Center, working with children and families. She feels respected by the other professionals and feels gratified working with her patients. Privately, there are some things bothering her in this new setting. She worries about perhaps being the only in her profession, being the only of her racial ethnic background, and are people looking at her differently and having different expectations of her. Being the peacemaker, the problem solver. We get into these professions because we want to help and we want to be problem solvers and peacemakers. And sometimes that makes us put our own needs aside when we're not having a particularly good day and feeling like we need to continue to do that. Being asked to do the diversity work, being asked to sit on a diversity committee or share some kind of a diversity initiative or presentation. Some of us choose to do that and we're really involved in it and we love it, but not everyone, not all underrepresented folks want to do that kind of work. And so it can be very taxing. And we use the phrase, the minority tax. And again, many of us enjoy really doing this kind of work. And for others, they're pulled into it. And oftentimes they're doing the work, they're not necessarily compensated for it or given extra time to do it. And it can be really draining on top of all the other injustices they may experience as a person of minority background. Focusing on others' self-care at their own expense and sometimes really hurting and not having a good day based on some of these things we're talking about, microaggressions and so on, but still having to focus on the other situations. That notion of perfectionism and that fear of failure and feeling like we represent our race, our culture, and we have to do well, or people will think we're all bad, or they'll stereotype us, that kind of thing. And being the representation of your race or identity. I see that in the chat that mentions classic situations. Anything you wanted to add?
Her microphone isn't working. She's not able to
Oh,
speak.
too bad. Okay. All right. Well, keep chatting, keep throwing stuff in the chat. But yes, and if anyone has anything to add at any time, certainly unmute yourself and jump in. So talking about kind of the big picture of building effective mentorship relationships, and the lovely thing, I absolutely love talking about mentorship and building mentorship relationships and so on. And, you know, I think there are some kind of big picture sort of umbrella ideas to work under, and then some specific different things to do as mentors and also as mentees. The mentees have a place in this also. So some of the big picture things, being able to understand the importance of trust and respect in the mentorship relationship. And, you know, kudos to Brittany for even bringing us together to have this conversation, because that's where the respect starts, really being willing to understand and put yourself out there and say, hey, you know, I might have a different background to you. I might not be able to relate to your life experiences, but I want to be there for you to help to build you up in your professional self and your personal self. Finding the right mentor-mentee pairing. And I've been on projects where we've put mentors and mentees together, and we've been fortunate. Most of the times it works out. Many of us naturally become a mentor or a mentee, become a part of that mentor-mentee relationship. And then, you know, you're drawn to someone who's like you, but sometimes you're put together in the mentor-mentee pairing. And maybe think about in your organization, in your group, if there's someone that you want to mentor, that just be aware that they will need certain things from you. Embracing a two-way street of mentorship. This is what I talked about. And again, in the mentor programs I've been involved in, the mentors get so much out of it. And a lot of times they learn even more than the mentee. So really coming at it from that standpoint as a mentor, that you have a lot to teach, hopefully, and your mentee has a lot to teach for you. So be a good talker and teacher, and also a good listener. And then establishing clear goals and expectations. And again, this is so huge. We hear this from our mentees, how helpful it is for them to really have help with goal setting and to really have you know, specific meeting times set up and a schedule for meetings and so on. So establishing clear goals and expectations from both sides. So growth areas for mentors. And I think of these as, you know, things that you can set as personal goals for yourself. And as you can see in this presentation, I'm talking a lot about, you know, having conversations that are not necessarily easy, you know, connecting with your mentee, perhaps based on, you know, them talking about microaggressions or past experiences with discrimination and so on. So it's really important to be able to self-reflect and think of your own personal background and what you bring to the mentorship relationship. And sometimes you'll have a similar background and your similar cultural ethnic background, you'll be able to relate to your mentee easily. Other times you might not, and that will take some work. So I put on here, and Brittany is going to be kind enough to put some links in the chat to two tools that I have been I have known about and used to help people go through a process of understanding their own cultural background. And so the social identity profile is a grid that shows on one side different personal characteristics, and then it asks questions on the other side of the grid of what your experiences have been with your particular social background. And so, for instance, under gender, you know, is this something that you're noticed for a lot? Is this something that you feel like you've been discriminated on based on that? With racial ethnic background, do you feel like this has opened doors for you? Do you feel like this has been a hindrance for you? And it's just a grid that you can fill out to reflect on your own identity and how your identity has been perhaps helpful and a sign of privilege, or has been made things difficult for you and you've experienced negativity or discrimination. The implicit association test, people might be a bit more familiar. And the social identity profile is in part of an anti-racism toolkit that I was a part of developing with some colleagues, and it's on the STFM website. So Brittany has put the link in there. The other one, the implicit association test, was developed by Harvard Medical School, and it's been around for a few years now. And what they do with the implicit association test, again, you go to the website, and it's a series of little self-tests that you can do. And you can explore whether you have biases in the areas of race or gender, or could be in terms of weight or something like that. And you go in and you fill out a questionnaire, and it just asks you to respond really quickly, and you get a score at the end, and it can tell you if you're showing significant biases in an area. And it can be really revealing. You know, they do different things, lighter skin versus dark skin, and it's such a good way to you just put your immediate response down, and it really helps you stop and think, because biases, we all have them, and the key is to be aware of them. So that's another tool that you can use to see if perhaps you have biases in a certain area. And so all of this is about really understanding yourself more and being able to connect with your mentee in genuine ways, and really working on your biases and trying to connect with them. As I mentioned, we've talked a lot about some things that could be uncomfortable conversations. We encourage our mentors to really embrace and lean into those conversations, and to receive that feedback, perhaps that you're not hearing them or you're not relating to them well, and really listen to that. And also when they're talking about their difficult experiences, as I mentioned before, instead of saying, oh, you shouldn't feel that way, to really try and connect and hear them and see where they are coming from. Think of yourself as a role model and someone, be the professional that you would want your mentee to be, and really make that effort to connect with them and be there with them. And then this whole notion of cultural humility, of being, it's so important, and many of us are educators, so important to know what we don't know. When you don't know what you don't know, you can't get anywhere. But to be able to admit, you know what, I don't know what it's like to be a first generation Mexican immigrant who has gotten a doctorate and is now thrown into this integrated behavioral health setting. I don't know what it's like to have come from that background and have gone through all the experiences you had to make it here, and just be really willing and open to check in with your mentee on that. So some skills for effective mentorship, as I mentioned before, being able to help with goal setting. So it's always important to set goals for yourself on the things you're trying to accomplish, and very important to set goals within that mentorship relationship and to help your mentee to achieve what they want to do. And we found that it really helps to think of it in terms of short-term goals for like in the immediate setting, and then longer-term goals as far as career goals. We can't take it for granted that people have their career mapped out. And so a wonderful tool that we use, and some of you are probably familiar with it, is being able to develop what's called a SMART goal. So it's specific, you really name and really narrow down the change you're trying to make. Measurable, you say it in, quantify it somehow. Achievable, something that's available to you and that you have the tools for it. Realistic, again, available, and also something that's within your purview and that you should be able to accomplish. And then making it time bound and seeing if you can say, I'm going to do this by this specific time. Another skill to be able to, in addition to being a mentor, being a source of support and encourager, you can provide sponsorship. And that means being really proactive in helping your mentee get to the next level. So maybe connecting them with people higher up in the organization that that you can introduce them to, and they can start forging a relationship if they're interested in going into leadership positions. And there's a whole area, I don't know how many people have been able to be involved in upstander training. It's upstander versus bystander. So when you see some kind of an inequity or some kind of microaggression or stereotyping, are you able to step in and stand up for that person? And some people can stand up for them right in that moment, sometimes standing up for them means going to them afterwards and say, hey, I saw the way that person spoke to you in that meeting, and seemed to me that must have been kind of difficult. And I want you to know that I support you in whatever emotion you're going through, and anything I can do to help in that situation. Sometimes maybe later you'll go and confront the person. So that's the difference between being an upstander and a bystander. And there's a whole area of literature on that, which I'd be happy to share with anyone who wants to reach out to me and find out more about that. I'm going to talk in a few minutes about using the ORS listening technique, which probably a lot of people on this call are familiar with. It stands for open-ended, affirming, reflecting, and summarizing. And I'll go through that just a little bit more in the next slide. And then helping mentees with self-care, and to really understand that your URM mentees often are putting their needs aside. And also early career folks, really of all backgrounds, put their needs aside because they're trying to shine. They want to look really, really polished, really like they know what they're doing. And it tends to put self-care in the background. So just to elaborate a little bit more on the ORS technique, and I really like to encourage mentors to practice really good listening skills, and to not only think of themselves as imparting knowledge, but also being there for others, to being there for your mentee and really listening and getting their ideas and thoughts. So starting out with open-ended questions, certainly. How are you doing? How are things going? What's been happening since the last time I saw you? Affirming statements as much as you can, finding those positives, and they'll be talking to you about things that are going wrong, or things that are difficult, and things that are hard for them. And as much as you can, to be able to be positive and encouraging and affirm them for the things that are going well and that they're doing. And then those skills of reflecting and summarizing, for me, this is I think of this as, almost like the things that I learned in kindergarten. It's the stuff that I learned in the beginning of becoming a therapist, and I use it all the time. So being able to be that good listener who says back to them what you hear. And again, you won't have had all of the experiences of your mentee, but to be able to say back, I think this is what I think I'm hearing from you. And so important to be able to summarize, kind of wrap things up, and come up with a goal for the next time, and so on. And so again, sort of back to the basics with the ORS technique. And then, as I mentioned, really being able to lean in and help mentees address self-care. And I'm wondering, I mentioned a couple, I'm going to see who wants to respond, but what are some of the barriers to those of us in early in our career, folks just starting out, just getting started, just joining organizations? What are some of the barriers you think to your mentees possibly addressing their own self-care? Like Brittany says, needing to prove themselves, absolutely, not wanting to make a mistake, and wanting to look like they shine. Gabby says, saying yes to too many activities. Oh my gosh, not having enough time for yourself. Yes, absolutely. Everybody needs a no button on their desk. Wanting to come across as a good team player, like you're willing to get in there and roll up your sleeves.
I feel like you never get to take time off. You work all day and then you have to go home and research all the things you didn't know in the evenings.
That is such a great point. That is a great point.
I would agree with that too. I think it's also a little bit of imposter syndrome, right? Of like, can I really do this? Do I really know this? I know this. Don't I know this? I think I know this. That kind of thinking.
Yes, absolutely. Another great point. Feeling this need to go home and learn the things that either you got them wrong that day, or you forgot, or you missed it, something like that. And then just worrying about, can I really do this? And that, a lot of times on your off time, you're trying to learn more, read more, study more. Definitely so many things that get in the way of that self-care, and all those burdens of being the one, the only, and feeling like, oh my gosh, I don't want them to think that I am like this or I am like that, and really wanting to prove yourself and stand out in a positive way. So imposter syndrome, absolutely. And we want our mentees to be able to talk to us about that. And we want to help them counteract that. You got here because you're qualified. You were chosen for this job because of the, great characteristics that stand out. And of course, you're earlier on in your career, you still have a lot to learn, but you know what? You really brought a lot to this situation. Saying yes versus no, we talked about that, and the burdens of the minority tax and feeling like, yes, I have to do everything they ask me, or yes, I have to be the person doing the diversity work, and really the stress of feeling like you cannot say no to that. Brittany makes a great point there, pressure for community involvement or advocacy. And some of that comes from within us. We want to do that. We want to do more, but it also comes from the people that we work for and people further on in the organization, and us being encouraged to do as much of that work as possible. And sometimes just really not physically having the time and energy to do it. So another thing to talk to your mentees about is to find ways to address those concerns about discrimination. And you won't always have a supervisor who is necessarily sympathetic or somebody you can be open with. But in a sense, I want you to think about being able to empower your mentees, and perhaps the conversation that they might have with someone is, I'm not sure I'm feeling very respected by you, or I'm not sure that you're really, you seem to be focusing a lot on the negatives and what I can't do. And I wonder if we can talk about my strengths a bit more, and perhaps some of the things that I do bring to the table. So that can be difficult. And sometimes it means connecting with people outside of your organization and being involved in, thank goodness for CFHA. Thank goodness, as I mentioned, I'm a member of the Society for Teachers of Family Medicine. So find outside groups and interest groups where you can talk about this stuff and feel supported. Again, find allies, and that's possibly going to be in other organizations. And sometimes it's hard to do that. You just have to sort of reach out. I know early in my career, I just happened to be talking to my former professor at my graduate school after I'd been in my job here in the residency program for a couple of years, and she would become a lifelong mentor, thankfully. And she mentioned to me a conference that I could go to where there would be other behavioral health professionals in family medicine. And that just changed my life completely. So it can be really helpful to find your allies in other organizations. And then finding that time, scheduling in that time. I was on a call yesterday. It's a mentee check-in for our Underrepresented in Medicine mentorship group. And one of the mentees said, I know I'm really busy all the time, but I have to find time to schedule in those my nurturing activities, those positive activities, those things that I like to do. And yes, absolutely, schedule it in, put it on your schedule. Gonna walk for an hour, gonna, go hiking, going to sit down and do some sewing or something like that. But definitely encourage them to engage in those activities that nurture their spirit. I've mentioned before about difficult conversations in racially discordant mentor-mentee pairs. So you may not have the same background as your mentee, and sometimes there'll be difficult conversations that have to happen. I mentioned before, be brave, lean into the discomfort, use your mistakes as a transparent learning session, be upfront and open about that, and just be willing to learn when you make a mistake. Be aware of how privilege can present itself in that conversation. And those are those statements like, well, you shouldn't worry about that. You know more than them. I never worry when I go into a meeting about how people are going to perceive me. So you know what? Guess what? Your mentee needs you to have a different conversation with them, which is that, gosh, I can't imagine what it's like to have to worry about speaking out in a meeting and for somebody to think you're being angry or hostile. I don't experience that as a white person, a person from the majority culture. So be aware of how privilege can present itself. Step back when appropriate. Your mentees, they know a lot about taking care of themselves, what they need, where they're headed. Yes, they need that help from you, but be able to judge, so you don't want to be, don't teach, don't preach, don't try to fix, don't try to jump in there and tell them what to do necessarily, but follow the mentee's lead and listen for an invitation to discuss difficult and oppressive experiences. They may allude to it, they might not quite come right out and say it, they don't want to offend you or make you feel bad in any way, but listen for those clues of when they're talking about experiences that they've had. So mentors can provide much needed support for early career professionals and particularly URM professionals. And I am more than happy to do training with mentors of all racial, ethnic, cultural, gender, all different backgrounds. And I really think that you can connect with underrepresented professionals and be a wonderful mentor for them. So in the interest of time, I thought it was a little ambitious of me to expect that we could have 2 breakout groups. So in the interest of time, rather than a breakout group, I want you to think a little bit about some kind of change that you can make. And I put the SMART goal acronym down there. It doesn't necessarily have to be a SMART goal, but just some thoughts, and just go ahead and put into the chat maybe some things, if anything in the talk resonated with you, some things that you think you could start doing or do a little bit differently. What do you think you could do to be an effective mentor to an underrepresented professional? Look into the Upstander research. Sure, I'd be happy to send that that literature to you. And feel free to put in the chat or unmute and just mention. Sure, help to normalize these discussions among colleagues. That is a really lovely goal, in terms of you don't want them to feel that they're strange or weird or unique. Let's have these conversations. Let's talk about it. The more we talk about it, the more we can understand it and deal with it. Absolutely. Research in the Upstander training. Yes, I can certainly get those. I can get those references to you, Brittany, and you can share them with your group. Set the stage and the atmosphere. Absolutely. Create that collaborative approach and the back and forth. And I'm going to learn from you as much as you're going to learn from me, and really set that stage and create an atmosphere to help the person feel comfortable opening up to you. Thank you, Robert. It was good to have you here.
Yes, everyone. It was wonderful to have everybody here. Just in sake of time, closing statements. Again, big shout out to Dr. Catherine Fraser. And if you want to hear more from her, there's 3 free videos on STFM under the URM mentorship that they're about an hour long. You can watch them. They're free. They're very helpful. More information about addressing microaggressions and supporting mentees. I found them very enriching. And so just a last shout out, we are calling for those leadership opportunities. Email Samantha Kettle, and look out for our upcoming webinars in 2024. Thank you so much for joining us.
Thanks for the opportunity. Nice to see everyone.
Thank you so much.
Thank you for being here. What a lovely group.
It was. Thank you so much.
Oh, of course, of course. Let's see. So MM is asking for links, probably for the is it for the Upstander training, you think? I think she, or
Yeah.
the link to, oh, maybe the link to the webinars you were talking about?
Oh, the videos. Let me see if I can find them quickly as we are on.
Okay. And I have the Upstander information on my computer. I'm gonna have to send it to you as attachments, probably.
Yeah, so we can post them with the video on our links.
Okay. I will certainly grab that.
And just putting the link in for
Oh,
the
okay.
program initiative for STFM. On the right side, you can find a curriculum. You can find facilitator's guide. You can find a link to the podcasts and the webinars.
And I'll just say quickly, Michelle, I can send you the Upstander information, and I'll also send it to you, Brittany.
Thank you.
Well,
All
thank
right.
you so much. Lovely group.
Thank you. Thank you. Any
All
other
right.
questions? Feel free to reach out via email and we can help. Okay. Thank you again, Dr. Fraser.
All right. Thanks. I'll talk to you on Friday.
Talk to you on Friday.
All right. Take care. Bye, Gabby.